Welcome in. I'm Colette Wieland alongside Dr. Stephen Camarata, the author of Late Talking Children, A Symptom or a Stage, now in its second edition. We have been breaking this book down kind of chapter by chapter, but some of these chapters have a lot of really great information to talk about. Today, we're going to talk about the misconception that's out there about late talking children and autism, which I know there's a lot of news out there about this.
Yeah, every year it seems like we have an update, and autism is supposedly increasing by these dramatic amounts. And what's happening is the autism spectrum is really expanding to the point where several years ago I wrote an article predicting that all late talking children will be called autistic. And that's not really accurate. So to characterize it, many children with autism talk late, but they have other things besides talking late that tell us they have autism. But it's certainly not the case that when a child talks late, they necessarily have autism. In fact, looking at traditional classification characteristics for autism, only about 1 in 10 late talking children or less actually would need the kinds of treatment we need to do with autism.
Yeah, you said early on in your career that a lot of these late talker children would be diagnosed with autism. But how can we change that,
Well, I think it's going to be very hard to change because there's a lot of resources and a lot of policy around autism, and so I think that's going to continue. And so what I want to talk about today a bit is when you have a late talking child and you get an assessment for autism and a label for autism, what you need to do and how to kind of navigate a system that's kind of predisposed to find autism in your late talking child, even when maybe it doesn't apply. Having said that, I do want to urge people to get services for autism when their child does indeed have autism. That's very important.
Okay, so who should they be seeking help from?
Yeah, well, that's the challenge, right? So the way that the system works in the United States is that there's going to be a child find when a child's 18 months. Their pediatrician is going to ask them, "Is your child talking?" If the answer is no, then they're going to actually refer them for an autism assessment. Now, that sounds good on the face of it because you'd say, "Well, I want to rule that out." But it turns out that a lot of times, well-meaning but misguided clinicians are trying to make the child eligible for early intervention services. And so if the child's not talking, there's a pretty high probability they're going to be identified as autism, even as I said before, when it doesn't really fit their other developmental profiles. So let me just kind of run through a quick cast of characters. So your pediatrician or your family physician, that's the healthcare leader. You want to keep them in the loop. They're just fantastic people. They're kind of given these guidelines for screening a child in various areas, and so they're going to apply those. Often the referral is going to be to what's called a developmental pediatrician, and that's kind of confusing because you say, well, all pediatricians deal with children, must be developmental. Developmental pediatrician is specifically trained in disabilities and how to identify them, and they should actually be doing a differential diagnosis, and many of them do. There's just many fantastic developmental pediatricians out there. Others may be very interested in getting a child eligible for services, and there's really a kind of a bias towards qualifying someone for autism because there's classes available, there's intervention support, someone might come to your home. That all sounds good, but if they're trying to support the child who learns differently with autism and they apply those techniques to a late talker that's not autistic, that can really be problematic and actually cause some problems for that child. So you want to be really careful about accepting a label just to get services.
Getting the services can take a long time, right?
It can. Yeah.
What was just going through my mind listening to you talk about all the different people you need to talk to, right? This could take months, maybe even years.
It can.
So at that point, is it too late? Have you missed the boat?
Oh, that's a great question because a lot of times people have this idea that if you don't get that magic learning moment that you're going to miss, a learning opportunity that'll be gone forever. It doesn't really work that way. Having said that, we do want to support development as soon as we can, but we want to support it in the right way. So anytime a child's late talking, I really recommend that you do some of the language enrichment things I talk about in the book or that are available in other books like Play to Talk, resources like that. So even while you're waiting for that assessment and that eligibility, there are things you can do to support your child's speech and language development. And I really recommend everybody do that when there's any concern whatsoever. There's no downside to that because they're basically enhancing normal mother-child, parent-child interaction strategies and doing a bit more to kind of nurture and help the child move along. They're not prompt-based, so it's not like we're saying, say microphone, say book, say purse. They're really more when the child initiates or looks or touches a toy, you name it in a playful, interactive way, which is how our toddlers learn best.
You've established this, that the majority of late talking children do not have autism, but almost all children with autism are late talkers. So when a parent, realizes their child's not late talking, it's a fair assumption. Their mind goes down that road of like, my child might have autism,
sure,
right?
Yeah.
So talk about the specific differences when you're evaluating them. What are you looking for a late talker? What are you looking for someone with autism?
Okay, yeah, again, really a great question. So basically, a late talker is anyone who's not using expressive words or using few expressive words by the time they're 18 months old. So that's everybody who's not talking. And it can be because they can't pronounce the words. It can be because they don't know the words. It could be because they have generally slower learning and they're learning at a slower rate. And it could be that they have autism, which entails a reduced motivation for social interaction. Children with autism are more isolated, and they're less interested in communicating with people. So because of that, even if they can talk, they tend not to because they're not really engaging socially. Another aspect of autism, the other thing we're looking for is if they really have this almost compulsive need to do things in the same way. So an example of that I teach my students is many children line up toys. That's not a sign of autism. But if they line up their toys and then you change the order and they get really upset and insist on them being the same order every time, that's an indication of this need for repetitive kinds of things and kind of making sure everything's done in the same way all the time. And then on the social side, what you're looking for is a child who is resisting social overtures not only verbally and not talking, but also non-verbally. So children with autism, what will happen is I come and play with them, and I'm a very playful person. I'm a grandpa 15 times over and love children, have 7 of my own. It's awesome. And of course, love all the children that come into the clinic. But I'll come and the child will be playing with a toy, and then I'll just very gently in a non-threatening way bring another toy or start interacting with them, and the mom will do this too, and they turn away. They actually resist these social overtures. And so a late talking child who doesn't have autism will bring toys to the parent. They'll show them the toys. They'll smile. They'll engage in this reciprocal kind of things in a way that says, I'm not talking, but I'm very interested in being social. And so that's a late talker who doesn't have autism. And it's important to differentiate that. Those are kind of the two key markers. I really also want to just say, as a parent, please don't take this on yourself. For sure, every clinician should listen to what the parent says, and I absolutely believe what the parents say. On the other hand, it does take someone who has experience with a lot of different children to kind of separate what's normal, terrible 2 behavior and what's actually a sign of autism.
I know, because some of the things you're talking about for normal developing, for lack of a better term, right. Those are things they do too, right? Like you're talking about lining up. I'm remembering my own children, and they might get upset just because that's how they wanted it, right?
I take pictures of kids lining up toys to show them my lectures. Kids who, I'll take a picture and say, okay, here's this lineup, and then I'll say, does this child have autism? And everybody goes, yeah, and then I'll play a tape of the kid, lining up the toys and talking like crazy, and then I'll mix up the toys and they don't care. So and just informally, at least a third of the kids I see will line up their toys in different ways. And it's a play routine, something they have in their head, but it's not compulsive, and in the video I show a child lining up toys and then I change one thing. I even change it one place. They start screaming, they have a tantrum, and then they insist on it being back the same way. And that's something. Again, though, I'm telling you these things that I'm looking for, but it's a bigger picture than that. I don't want parents to just look at one thing. You want to trust your instincts, and you want to listen to that little voice that Mary talked about previously. But you also want to be sure that you're having somebody else who's being fair and objective, but also have them look at it. As an aside, there are times when I see autism, and the parents will say, no, that's my child doesn't have autism. And I also want to say very carefully here and very clearly that some of my colleagues will say, well, you have to get them to accept the label. I don't agree with that at all. What I say to the parents is, okay, you and I disagree. Here's why I think your child has autism. I value your input. We both agree I need to teach your child how to talk. Let's do that, and then we'll revisit the autism. And if I'm right, they'll still show signs of autism even if they start communicating. And then it'll become more obvious. So I don't really feel like I have to ram a label down someone's throat. Yeah. If someone's trying to ram a label down your throat, please don't accept that. Because there's lots of times when people do try to ram labels down people's throats and it's not accurate, and then you're kind of going down the wrong path for your child. So the clinician should be very supporting and listening, and if there's a disagreement, they should be nurturing and helping. And I'll be honest with you, if your child has autism, it's a journey. It's going to be a journey that has a lot of joy, but it's also going to have a lot of challenges. And the best thing I can do is support the parent in that journey as it unfolds, because I know what's coming for them in a good way, but also in a challenging way. And so, there's no reason for me to develop an adversarial relationship with that family. I want to develop a nurturing, supportive relationship because I want to do that with everybody, but especially in autism, there's going to be so many challenges that they need my help with, and I want to be there to do that.
With autism, there's sort of this classic autistic diagnosis versus the autism spectrum. Can you kind of help break that down and what that means?
Yeah, I'm really glad you asked that. So it's gotten to the point now in my practice or when I work with children that when I get an autism spectrum label on a report, I have no idea that's going to walk in the door. It might be a child who is a bright late talker who's simply on their own schedule, or someone who has real challenges communicating, learning, and really has high support needs. So historically, autism was a very specific condition that was described actually in the 1940s by Leo Kanner. And ironically, in the 60s and 70s, he wrote about how he was worried about the autism spectrum was expanding so much that you didn't know what it meant. And of course, since the 60s and 70s, we've seen something beyond even what Leo Kanner would have even, he couldn't even imagine. And why it matters is that, and again, I'm fine with people classifying different challenges in different ways, but at the core of autism is that historical definition, which requires very, very specific, very intensive intervention to support. And that same intervention is actually not helpful in children who don't have autism, and that's what I worry about. There's a lot of prompting, there's a lot of changing of the social interactions that naturally happen. Children with autism are ignoring those social bids, so they miss those learning opportunities. Children who don't have autism are still learning from them. But if you're doing the classic, the autism intervention, you're actually changing the whole social dynamic to support social development in that child, and that's really harmful. A couple of parallels. I think of autism intervention as kind of like what we might do for cancer. So you might have a skin lesion, and you'd say, okay, I'm on the cancer spectrum, you've got to have radiation. Well, radiation is really important for some kinds of cancers. Yeah. But on the other hand, if you just have a little, and again, I'm not a physician, I'm using this as a parallel. So you don't want to give everybody radiation or chemotherapy because they're on the cancer spectrum. Similarly in diabetes, diabetes ranges from people who have, pre-diabetes, a little bit of high blood sugar, to people like me that need insulin to live. So are you going to say, oh, you're on the diabetes spectrum, you get insulin? You're going to kill about 80% of the people that are on the diabetes spectrum because, someone who's pre-diabetic or many of our type 2s, they make insulin. That's not really what they need. It's a different mechanism. So we want to be really careful about the autism spectrum. Bottom line now is that the autism spectrum has become so broad, you really need something beyond that. And you want to ask questions about, why do you think this? What are the different features? And you want to know that. Still to this day, a diagnosis of autism should have reduced motivation for social interaction and communication problems, and this reliance on routines, stereotypies, and things like that. Both of those are supposed to be present for autism. In practice, because people are just trying to qualify for services, oftentimes these things, many late talkers are being pushed into that even though they really don't match that definition. So you want to be cautious.
In creating this spectrum, if you will, it's easy just to go late talker.
That's what's happening out there a lot. Yeah. I mean, a recent case, child basically really is just a late talker. Nothing else is wrong. They they have a low vocabulary, they're leaving the endings off of words, and that does create some social differences, interact with peers. Everything else is fine. The child's conversational, they interact with toys, they do pretend play, they don't have these routines. It didn't matter. The school's now trying to put that child in a separate classroom for autism and take them out of the regular education place, and that's really not the right thing for that child, and we have to kind of fight that battle for that family.
I know every school districts probably work similarly, but also very differently, right?
Sure, yeah. There's great schools and schools that are less great. Sure.
So if you have a child who is simply a late talker, but gets put on the spectrum and gets, the services, do they outgrow it? Do they no longer get a label later on? Like, explain how kids get caught up in that.
Yeah, long-term studies of children with classic autism show that, they don't really grow out of it. That they can improve, they can learn things, they can learn to people can learn to communicate, autistic people can learn all these things, but the core features of autism stay, so that part's, we haven't gotten to a place where that can go away. But a lot of children who are initially identified as being on the autism spectrum, mistakenly, they don't show signs of autism as they get older. And to me, in my way of thinking, it was really that they were misdiagnosed. Other people will say, well, they had intervention and so on, and so that actually cured them. Yeah, and so that's a dispute, and hopefully our studies down the line will help us to kind of separate that.
Are you seeing a lot of the kids that have a speech delay and then outgrow it?
Sure. Yeah.
Are you seeing them being able to get away from those labels?
Yeah. I mean, oftentimes, so special education services, once they no longer qualify, then they're no longer applied. That happens a lot.
Okay.
And then sometimes they'll migrate. So children would have expressive language delay or receptive language delay, like my son. They'll go and they'll have a language disorder, and then as they learn to read, about half of the children who have language disorder have trouble reading, and so then they migrate to learning disability reading problems, and that's a very normal kind of path too. And then many of them, once they get through the initial phases, then they're no longer qualifying for services. Many children that just have pronunciation problems, speech errors. There's still little subtle differences. You can kind of, if you have a good speech ear, you can kind of hear little distortions and things like that. But really, there's not necessarily any long-term, big picture pronunciation problems. And usually, by the time they're in late grade school or middle school, then many of those have resolved. Again, there are children with apraxia where they have a severe speech disorder, and that's going to persist. Some of those, we actually have to have a computer talk for them. And so, but that's rare. That's not very common. Most of the children with speech problems, they're gonna with intervention or on their own, they're gonna catch up and resolve.
About 10 years ago, I read that new guidelines were implemented here in the U.S. About how to diagnose someone on the spectrum. So, how did that criteria being used, for the last 10 years, really impact those with speech delays?
Yeah, so it's not uncommon, sadly, that I'll have a child with just straight speech problems, severe speech problems, so they can't really pronounce their words, and then that has these impacts on their social interaction, and then they get put on the autism spectrum, even though it's just a straight classic speech delay. And so basically the changes in the criteria were good in the sense that there was no longer this differentiation among these subtypes of autism, which was really not very accurate. But a downside of it, perhaps from my point of view, is that instead of the classification historically as a severe challenge, now in the 2013 guidelines, you simply had to assign a support level. So you'd have level 1, level 2, level 3, where level 3 was severe. Level 1 people on the autism spectrum, they don't have much in the way of support needs. So you could think of that as mild. It used to be called high functioning.
Okay.
It used to be called Asperger's. And so the people with autism spectrum disorder with level 1, they may fit autism, but then again, they may not, and they may just be put into that bin as a low support need. And so that may be driving this expansion in the incidence of it, in the numbers, yeah. And then the other thing that happened was this idea of early identification, where it's identification as opposed to differential diagnosis. So the idea is now it used to be that you would never identify autism unless it was very severe before the age of 3 or 4 or 5. And now they're trying to, the idea is to have every 18-month-old or every 2-year-old screened in the whole U.S. Well, again, as you said, the terrible twos, in a way, you could put almost any 2-year-old on the spectrum. They don't listen, they spin, they have meltdowns, as every mom knows. And so I'm being a little facetious, but if you're late talking and you're a 2-year-old, then you really need to do good detective work to separate it. And that's the challenge for clinicians. Because, again, they don't have hours and hours to do an assessment. They have like 20, 30, 40 minutes. They're doing a questionnaire, and then, boom, they're putting them then into services. And that's maybe not the most accurate way to do it.
Okay, so I know a lot of parents probably want to know, what questions should they be asking if someone is trying to place their child on the autism spectrum?
Yeah, so the main question you want to ask is, why do you think my child has autism? Tell me specifically what you're seeing. And then you want to ask them, what kind of treatment are you recommending? There is a kind of this package treatment. It's called ABA. That's not really the right name, but people call it that. It's called Lovaas after the scientist who developed it. And if you're going to put a child on that, they really should have classic severe autism. And even then, they should not be prompt resistant. And what I mean by that is, if you hold up a cup and say cup, and they really resist that, you don't want to use that treatment. So the point is that you want to ask them, why do you think my child has autism? And then what kind of treatment are you recommending? And there should be specific answers as to what they are seeing that makes them believe their child has autism. And they should be offering a range of interventions with the idea that you're going to try to meet that child's needs specifically for the traits that they see. It shouldn't all just be autism, ABA. It shouldn't be like that at all. And then the other thing is, if it's a special ed setting, can my child be in the regular classroom? People have a right to be in the regular classroom unless they cannot be supported there. And so the burden of proof is on the school. It's not autism, then they can't be in the regular classroom. And so you really want to fight to keep them in what's called the least restrictive environment. For some children, that's going to be the regular classroom. For some, it's going to be sometime in the regular classroom, sometimes in a special support services. For only a very few children can they not necessarily be included. Those are the ones with the high needs. And so you want to be sure you understand what's happening with your child, and you're not just being given a package that may or may not fit your child. That's crucial.
What are the consequences if a child who you think should be in a normal classroom setting gets put into a special needs classroom?
Yeah, we have a lot of data on this. They just don't realize their potential. Let's say your child doesn't have as many support needs. Well, the classroom's geared for lower support needs, lower speed of learning. They're just not having opportunities to learn. On the treatment side, I also want to mention something briefly, and that's that there's a lot of treatments that I call non-evidence-based. And so when children are being put on the autism spectrum, they might be offered special diets. They might be offered different kinds of massage therapies. They might be offered chelation, which is a detox. There's a lot of these things that are offered that aren't scientifically based at all, but they might be harmful. And you just don't want to do that. A last kind of comment I want to make on the treatment side is, you want the treatment to address the things that are being identified as weaknesses. So if a child's having trouble learning how to talk, we want to teach them how to talk. If they're having trouble learning to be social, we want to help them learn to be social. Okay, putting a weighted vest on them, having them listen to magic music headphones. I'm sorry, I don't mean to be pejorative, but there's these kinds of things out there. Having them take expensive vitamins, all these kinds of things are not working directly on what the child needs to learn. So it should be on, learning to read as they get older, learning to talk, learning to be social, the things that you notice, and then helping them to tolerate variation in their routines and so on. That's a very gradual, thoughtful process. But all these magic cures. Oh, another thing they do is a vagal nerve stimulator. Vagus
what
nerve.
What is that?
Oh, vagus nerve innervates the larynx. There's a bit, like all these things have a germ of truth in them. So people that have epilepsy, some kinds of epilepsy, if you stimulate this nerve that has to do with breathing and heart rate, and it also innervates the larynx and kind of the outside of the ear, it actually seems to have a benefit for that from what I've read. I'm not a physician, double check this. But the idea that it helps autism or late talking and so on, it's just not true. But it's being pushed on families. They're expensive. There's just a lot of these miracle cures that are out there. So,
real quick before we go, I want to talk about.
Be a good consumer. Sorry,
you're fine. I want to talk about why age is important, and we can get more into this in the next episode. But just real quick, why is age important when you're trying to diagnose late talking versus autism?
Yeah, also just a fantastic question. So a developmental specialist should be able to look at a child and say, okay, at this age, what should they be doing and what's different? It shouldn't just be, oh, here's adult behavior and this child can't do X, Y, and Z that an adult does. Okay, so for example, if I have a child who is having trouble saying their S's and they're 2 years old, that's normal for a 2-year-old. If they're 10, we may want to work and help them learn how to make S's. Same thing's true for vocabulary, length of sentences, social skills, play skills. Children who are toddlers, they don't do interactive play. They don't play with other children. They play by themselves. And as they get into preschool, they do parallel play. Will be next to each other. They don't do coordinated play until they're older. So if I see a late talker or a child with autism who's not doing coordinated play at age 2, I don't think that's going to be a reasonable goal, and it's certainly not a marker for disability. So you want to have this developmental framework where you can say, okay, here's what the child's doing that's in line with their developmental age. And a lot of our late talkers are doing things that are ahead. They can do puzzles. They can remember things, and many of them know numbers and letters to a way that's advanced. So are they advanced? And then what are the things where they're behind? And you want to have that developmental framework in your head. Absolutely crucial.
We're going to talk more about that on our next episode.
I have a lot of passion about this.
We're going to talk specifically too about the toddler age, right?
Yes, right, yeah. So, Can't wait for that. Love toddlers. They're wonderfully exciting little creatures.
They are.
Who are strong-willed on average.
In the meantime, we want to know what you learned today. What was the key takeaway for you? Please tell us in the comments below and help us keep this conversation going. Let us know what's on your mind. We look forward to answering any questions you leave in the comments section. Be sure to click subscribe and hit the bell so we can keep this information coming to you. And please check out the Late Talkers Foundation website, latetalkers.org. It's got lots of great resources for families.
And always remember, the best thing for your child is you.